today I want to talk about an easy way to help improve your respiration and breathing patterns. And when we talk about this, what I'm going to focus on is when the air is coming into the system. And for some people, we do this by breathing in through the nose and exhaling through the mouth. Some people are mouth breathers where it's all breathing in through the mouth and exhaling through the mouth. Well, the key here is when you breathe in through the nose, what you're able to facilitate is release of nitric oxide. And nitric oxide is a gas that helps dilation of the blood vessels. And this is key because when you open up the vessels, you're able to send more blood with oxygen to the areas that need. And you're also able to pull out more carbon dioxide at the capillaries and get all that bad nutrients out and byproduct to then shift it out to then be disposed of later, so then you can pull in more. So one key thing is we're trying to improve that blood vessel or the area, expand it to get more blood into those regions. And you can easily do this by breathing in through the nose because we have a facilitation there of NO. Now, as it gets more towards the lungs and the bronchi, there happens at bronchial dilation as well. So what they've seen in research is nitric oxide's up at the upper respiratory tract. So right when we start our respiration of bringing air in, it is stimulated to then allow the blood vessels to open up bigger, get more blood in. It's going to pull that oxygen with the hemoglobin to the areas at site, and then it's going to pull that carbon dioxide out and all the wasted products, and then where this can recycle. Okay, so then you get this bronchial dilation that's allow you to get that blood to the area and the oxygen to get more transfer of oxygen into the blood to then to the muscles. And a big key one that is huge in CF is a defense against bacteria, right? So when there's bacteria in the lungs, there's more inflammation, there's scarring, and all of a sudden this is kind of a cycle effect. So one key thing is to reduce the amount of bacteria within the system that's going to fight against healthy lungs, right? Well, NO is a stimulant in a sense it helps break down or fight against this bad bacteria. And that's going to allow that system, so when the air comes in, we're bringing particles in, we're bringing various different organisms microorganisms into the body. Now, if we're able to start by breathing in through the nose versus mouth breathing, we're going to get this defense up right off the bat, and it's going to help break down this bacteria, so it's going to have to work even harder to get into lungs and create that situation that's going to cause that inflammation, stuff like that. So think about when you're doing your breathing treatments, or think about just in general, okay? Breathing in through the nose, and then nice and easy exhaling through the mouth. That is going to help kind of start this cascade of events to help put you in a better position to utilize that oxygen. Plus, it's a big stimulant on just decreasing stress. So if you're ever in a stress situation, take a couple breaths in through the nose and exhale through the mouth. You feel a little bit calmer, relaxed, and you can start to make better decisions. Another thing that we talk about, this is more from a physiological standpoint, but breathing in through the nose is going to help turn that diaphragm on, get those core muscles to work, those postural muscles. It's also going to help position to get more air into the lungs because you put the body in a better position, versus when we breathe in through the mouth, we're going to get a lot of neck muscles, chest muscles. It's going to change our posture. So breathing in through the nose and exhaling through the mouth elicits a lot of great positive effects. But from a physiological standpoint, if we can get nitric oxide to fire or be stimulated sooner, we're going to get this vasodilation, and then from there we're going to get this bronchial dilation, and within those vessels we're going to get a better exchange of oxygen, carbon dioxide, get all those byproducts out, and then it's also a defense against that bad bacteria that we don't want to get into lungs and create that inflammation and scarring. So just think about couple breaths, 2, 3, 4 breaths in through the nose, exhale through the mouth. Once again, subconsciously, you're not necessarily always going to do that, but try to work on just quick and easy, nice diaphragmatic breaths, and it's going to change it from multiple factors. And stay tuned as we dive a little bit deeper into respiration and exercises and different things that you can do to help improve your quality of life.